Want a second opinion on Canada's response to the pandemic? David Redman spent nearly 3 decades in command in the Canadian military. Afterwards, he worked as head of Alberta's Emergency Planning Agency and as an internationally recognized consultant. Today, he provides an expert's opinion on what's gone wrong with Canada's emergency planning process.
A pandemic is not a public health emergency. It's a public emergency. In Canada, we have an emergency management process we normally use in a pandemic. We have pre-written pandemic response plans. The 4 goals of the pandemic plans are clearly defined. Number 1, control the spread of the disease and reduce illness and death. Number 2, mitigate societal disruption by ensuring critical services. 3, minimize adverse economic impact. And 4, support an effective and efficient use of resources. The purpose of these plans should be obvious. The response to the pandemic would then be coherent. This has not happened. The Canadian response to COVID-19 has been incoherent. The focus on COVID-19 case counts has led to a completely flawed response, trying to deal with only the first pandemic goal and failing. In February, we knew that over 95% of the deaths in China and Europe were in seniors, over the age of 60 with multiple comorbidities. We should have immediately developed options for the protection of concentration of our seniors over 60 with comorbidities. Our long-term care homes should have been placed into quarantine for both the residents and the staff. To date, in Canada, over 96.5% of our 15,000 deaths have been in seniors, again, over the age of 60 with multiple comorbidities. That's just over 14,590 deaths. It's likely thousands of these deaths could have been avoided, as 80% of the deaths in the first wave alone occurred in long-term care homes. Now, this may have cost $1 billion, but it could have saved over 12,000 lives while negating the need to lock down business and spend over $200 billion to force over 8 million healthy Canadians to stay at home. We did not need to follow the failed lockdown practice of China or Europe. We knew who was most at risk, and we had time to quarantine our seniors in long-term care homes. Our leaders and doctors constantly tell us we are in danger of overwhelming our medical system. If we'd acted to quarantine our long-term care homes, our hospital capacity need not have been challenged, because 71% of our hospital beds and 64% of our ICU capacity to this day are filled with seniors, most from long-term care homes. We would not have needed to stop other medical procedures. We should never have forced healthy medical staff to self-isolate. We should have made rapid testing a priority for all orders of government. It is still not a priority. As well, if the other 3 goals of our pre-existing pandemic plans had not been ignored, the massive collateral damage to our social fabric, our mental health, our other health conditions, our children's education, and our economy never needed to occur. We've massively impacted the rest of our citizens for generations to come who have extremely little risk of dying of COVID-19. Why? Because our leaders continue to abandon emergency management process and give in to fear.